Okay, sounds like we're alive and ready to start. So, a very good day to your colleagues from across the world and a warm welcome to each of you. Thank you so much for joining our APMEN online vector surveillance course, which I absolutely have no doubt you're going to enjoy and also learn a great deal along the way. So this online course is another of the range of capacity strengthening initiatives that are organized by APMEN in support of malaria elimination. I'm sure you know by now that APMEN stands for the Asia Pacific Malaria Elimination Network, but our courses are as relevant in South America or Africa as they are in Asia. So welcome aboard wherever you're from. Uh, you will learn as much as our primary target audience here in Asia Pacific. We're fortunate indeed to have as our course trainer someone who I firmly believe is the top world expert in the theory and practice of vector surveillance, and that person is Professor Neil Lobo. He's the guy on the screen with a beard. Looks good, isn't it? Neil is not a couch academic. He's deeply involved in a very hands-on way with vector control projects across the world, with very deep experience supporting national malaria control programs. And he has a wonderful way of sharing his experience. You'll get to like him over the next 3 days. Before I introduce you to Neil, let me say something about how this training is going to work. The sessions are all being recorded and they'll be available on the APMEN website. Wulan will post it. Wulan or Dr. Porn will post the website URL in the chat box. If you want to go back to the lessons or share the link with friends. Our course will be over 3 days, today to Friday, for about 2.5 hours per day, which includes a 10-minute comfort break midway and a Q&A question and answer session at the end. Please listen carefully. Certificates of attendance will be issued to all people who attend each of the 3 days for at least 90 minutes each day, based on computer system records of attendance. We always have issues with this, people writing in and asking for certificates of attendance, but they had to miss it because they had a meeting on and so on. So sorry, guys. We have to draw the line somewhere, and our line is that you must have attended each day for at least 90 minutes, and our computer records will show that. And then also please note that the certificate will be sent to the email address that you provided during the registration process. During the training sessions each day, please feel free to post your questions and requests for clarification, but please put them in the Q&A box, not the chat box. Thank you for that, because we can't monitor everything and also focus on, the training course. So we'll focus on the Q&A box. If you have questions, put them in the Q&A box and we'll do our level best to respond. So let me introduce Neil, who's going to lead us through this course. Here I've written a bit of a blurb. Professor Neil Lobo is with the University of Notre Dame in the USA and also the Malaria Elimination Initiative at University of California, San Francisco. His research and government support takes him to malaria endemic countries all over the world. His primary interest is to clarify how the various aspects of malaria transmission interact, and he integrates vector bionomics, social behavior, environmental factors, and others to better understand the root causes of persisting transmission and improve protection on a granular local level. I should also mention that Neil is the person who developed a very comprehensive entomological surveillance planning tool known by some of you and many other people as the ESPT, which is now being used in many countries around the world, malaria control programs, NGOs, etc. It's a top quality entomological surveillance planning tool. Neil developed that. He will make reference to that during the course of the training, and he will also give you the link for the ESPT because there's an electronic version of that, and Neil will explain to you about accessing that. Before we start the course, I'm going to ask your help, please. Please be indulgent and patient with me to measure the increase in your knowledge over the duration of the course. We'd like to ask if each of you could do a short vector surveillance knowledge test at the start now and at the end of the course. You're not going to fail if you score poorly, so please don't worry. And your score will not be open for others to see. So please maybe ask your patients to fill in this online questionnaire. It helps us understand the value of the course and where we should focus maybe a bit more and so on. Please don't use Google or search online for an answer. That doesn't help us to understand how effective this training course is to improve your knowledge. We need to know your real knowledge. So please just use your own brain. So I'm going to ask Wulan to tell us how to access that online questionnaire. And then as soon as Wulan has finished speaking, please access that questionnaire. And then you've got 20 minutes to respond to the questionnaire. I can't remember how many. I think it may be 15 or 20 questions. And they're kind of multiple choice. It's tick box questions. But you need to read carefully and then respond. So focus and concentrate. Read the questions carefully because you can get confused. So try and focus. So Wulan, I'm going to hand over to you if you don't mind to explain to us how to access that. Please, Wulan.
Sure. So I'm sharing my screen. Can you see it?
Yeah, very clear. Thank you.
Good. So hello, everyone. Thank you for joining the online training on vector surveillance hosted by APMEN, APMEN and the Malaria Consortium. So before the training begins, please complete the pre-test using the link that I shared on the chat box. I'm going to share it again here. Please do not post any comments for the moment so that other participants can see what I posted on the chat box. And then once you click the link, you will see the page. And then please put the same email address for the pre-test and also post-test. So it's easier for us to track when you complete the assessment, the pre-test and post-test. And then answer all the questions. We will give you 20 minutes from now. So once you finish answering the question, don't forget to click submit. Well, that's all. Thank you.
All right. I think that's fairly clear. Wulan, you put the link in the chat box. I don't see it, and people are saying still not opening, link not working, can't access, can't be opened, unable to open. We've got a problem.
It is opening for me.
It's
It is
opening.
working for me, so it might be at their end. And there were a couple of comments on Leo not being loud enough, but it is loud enough for me as well. So unfortunately, it might be internet connectivity or something like that from the participants' ends. I hope it gets fixed.
Ah, thank you for that, Neil. Thank you. Okay. I can't really speak much louder because I'm speaking directly into the mic here, but I see Dr. Pawn has reposted the link. So maybe try again if you don't mind. And you've got 20 minutes starting, boom, right now. 20 minutes. Thank you so much, everyone. Have fun. Test your brain. Thanks so much. I'm going to keep quiet now. All of us are going to keep quiet. Thank you.
All right, done for pretest. You can start the training now.
Wulan, I'll give him another 10 seconds. Then it's exactly 20 minutes, according to the watch I'm watching. Okay, but thank you for that reminder. We've had a wonderful, wonderful, strong response. So thank you, everyone. Very good response. This is going to be a good sample to give us an idea of the knowledge on day one for you and for the group. And then at the end, we'll compare you with yourself and then the group with the group. So very good understanding that your responses will give us. Thank you for spending that time. So I'm not going to bore you with my voice for any longer. I'm going to hand over to Neil, but let me just mention, because we spent 20 minutes doing this very valuable exercise, it's eaten into our lecture time. So we'll shorten it to, it's up to Neil really, but my suggestion is roughly 45 minutes lecture, then a 10-minute break, and then a roughly 45-minute lecture. It depends on Neil, how long he wants to take on each of the two sessions, and then we'll have a Q&A session right at the end. So thank you again, everyone. Thank you, Dr. Porn, and thank you, Wulan, for your help in the background. I now hand over to Neil. Thank you so much, Neil.
Hey everyone, I'm Neil, and I'll be running this training with Wulan and Phone and Leo, and I'm going to start sharing my screen now. I think, wait, that's the wrong screen. Start off by sharing the wrong screen. There we go. Perfect. So today and over the next 2 days, so 3 days total, we'll be going through the vector surveillance course. And I hope this is useful for you. Please use the question box to ask as many questions as you want, as you would like. And I will start off now. So what I usually do is I have a bunch of presentations, and you have to be patient for me while I switch between presentations. So the first one is just sort of a background and why entomology and entomological surveillance is so important in our field. And there we go. So if you look at the figure on the right, on the left is all the names of all these countries, and on the right is how much malaria has gone down over the last few years. Right? As you can see, it's actually quite a lot. Over 15 years, malaria has gone down in all these countries. And the publication cited at the bottom, Butt et al., actually did a modeling exercise that demonstrated that most of this malaria has been due to vector control interventions, as in what we're doing over the next 3 days, vector surveillance, and how that functions within the system. Since 2000, over 663 million cases have been averted because of interventions, and these interventions include bed nets, IRS, and of course treatment and larval siding. So why are adult interventions so successful? Why are mosquito control interventions so successful in our field? Really interestingly, it is based on mosquito age and malaria. Oh, I forgot. In this first presentation, I'm going to go over a couple of sort of important concepts to keep at the back of your mind over today and the next 2 days. So mosquito age and malaria actually has a lot to do with how vector control interventions are so successful. So the survival rate of a mosquito every day is about 80%. So if you have 100 mosquitoes today, tomorrow about 80 of them survive. And the next day, about 80% of those survive. Right? That's one thing. The second thing is Plasmodium, or the malaria parasite, takes 10 to 14 days to mature in mosquitoes. So if a mosquito bites me and I have malaria, Plasmodium takes about 2 weeks to become mature enough to infect someone else. So over those 14 days, the mosquito cannot infect anyone else. So mosquitoes only infect people. can infect people after those 14 days. They're only infectious after those 14 days. And so old mosquitoes are more infectious. Young mosquitoes are not infectious. Young mosquitoes under 10 days old usually cannot transmit any malaria, even if they have the parasite in them. And to explain this, I have a couple of figures. Uh, Here we go. So if you look at survival rate being 80, and on the y-axis here, you have 1,000 mosquitoes. And on the x-axis is the number of days, right? So let's say we go all the way down to 22 days. So on day one, we have 1,000 mosquitoes. On day two, we have 80% of them out here, about 800 mosquitoes. Day three, we have 80% of that. Day four, we have 80% of that, and so on. So you can see over the space of 22 days, the mosquito numbers reduce drastically. Now, let's say on day two, these mosquitoes get infected. Let's say 1,000 mosquitoes, all of them bite me, and I have malaria. Poor me, 1,000 mosquito bites. But every single one of those mosquitoes gets malaria. So over the next 10 to 14 days, even though all those mosquitoes are infected with the malaria parasite, they are not infectious to anyone. So all those mosquitoes can bite every single person in this session today, and none of you will get malaria, even though they have the malaria parasite in them. Only after that time point, in red, are they infectious to human beings. So if you look at the figure above, right, if with all the blue mosquitoes, right, can't infect anyone, and only the red ones can. And I said 100% of those mosquitoes bit an infected human being. And normally that's not true. Not all those mosquitoes, not all the blue mosquitoes will bite a person who's infected. And so therefore the red part, the infectious mosquitoes, is actually less than all those mosquitoes. So with the daily survival rate of 80, the total number of mosquitoes in this figure, if you add up the number of mosquitoes on each day, is about 4,963. Of those, only about 392 are possibly infectious to human beings. That's about 8% of all these mosquitoes. So let's see what happens. Now, if you have an intervention like a bed net, an adult mosquito intervention like a bed net or IRS, what happens is that you increase the death rate or you decrease the survival rate, because every time a mosquito enters a house to feed on a human being, their chance of dying goes up. So their survival goes down. So now let's see. Let's say we reduce the 80% to 65%. It's a 15%, a 15% reduction in the daily survival rate, right? Now, the green on the left is what happens to that mosquito population. Every single day, 65% of them survive. And you can see at the bottom of the figure, the red, which is really narrow. I hope you can zoom in on that, is really narrow, is not 15% of what was infectious for 80% survival. It is a lot less. It's almost 10 times less. So you can see how an adult intervention that impacts the mosquito population or the age structure by 15%, by having a 15% of daily survival, actually exponentially increases exponentially decreases the number of old mosquitoes which are possibly infectious to human beings. And that is this sort of little bit of red stripe at the bottom versus the orangey part above. So you can see with the numbers, there was 8% for 80% daily survival, and it's only 0.8%, 10 times less for 65%. A 15% reduction in the daily survival results in a 10 times reduction in potentially infectious mosquitoes. So you can imagine a really good adult intervention, like better than bed nets or better than IRS, can possibly, let's say, this has a 50% impact on disease, right? You can see like the lighter blue down here is 50% impact, not on disease, on daily survival. You can see you have so few mosquitoes, you can't even see them, the old ones. You can have a lot of mosquitoes in your system and almost no malaria. So I hope this sort of clarifies how and why adult mosquito interventions can be so efficacious against disease. And this is primarily because they reduce the infectious proportion, which is the old mosquitoes. I hope this is clear. So, larviciding or looking at larvae is actually really important. It's another intervention, larviciding, larval source management. How does that function? Because larviciding doesn't actually decrease the number of older adult mosquitoes. It just reduces the number of adult mosquitoes, right? So how does larviciding impact malaria, or how does it possibly impact malaria? Now, let's assume that larviciding has an impact. Let's go back. So this is the initial figure I showed you, right? Adult survival rate of 80%. Let's say larviciding has a 50% impact on emergence. So if you have 1,000 larvae, only 50% of them emerge. Your larviciding is only 50% efficacious. I'm completely making up this number just so that we can look at it on a graph. What happens is we have 50% of those mosquitoes being adults. But since larviciding does not impact the age structure of the mosquitoes, it does not impact the daily survival of adult mosquitoes, that remains the same. Every day, 80% of those larvae that emerge with larviciding will emerge and continue to have malaria. So even though the total number of adult mosquitoes goes down, the potentially infectious number also goes down by the same amount, but the proportion remains the same. I hope that made sense. If you think about it, right, you just have the same number. I mean, you have half as much adults emerging, but nothing happens to those adults as they age. They age at the same rate as the adults without the intervention because they do not have an adult intervention. So when you're thinking of applying an intervention, whether they are adult interventions or larval interventions, try and understand or look forward and try and see how your intervention might impact disease transmission. And this is why WHO has larviciding as a supplemental intervention. Larviciding is in the check pattern there. It has it as a supplemental intervention because it doesn't exponentially impact disease transmission. It impacts the number of emerging adults. And you can kind of see why in this figure how 80% impact on adults has this orange impact. A 65% impact on adults has this tiny uh, red impact. And even though larviciding had of 80%, in this figure, sorry, this 80 should be 50. I made a mistake. Even though larviciding had a 50% impact on adult emergence, the proportion of adults that are infectious remained the same, which is 7.9%. So just to repeat, whenever you're implementing an intervention, try and figure out how they function in your system and what impact they might have either on emerging adults or your infectious proportion of adults. Sort of a concept number 2. Transmission is sustained by 2 parasite reservoirs. If you look at any disease transmission system, or at least with malaria in any system, you have mosquitoes that are infected with malaria, as well as humans that are infected with malaria. And the parasites are transmitted from the mosquitoes to the humans, to the mosquitoes, to the humans, and its cycle just goes on. If you eliminate parasites in the mosquito, you still have parasites in the human transmitting disease. If you eliminate parasites in the human, you still have mosquitoes in the system giving humans the disease. And our intervention strategies focus actually on reducing the transmission between these two systems, between the human system and the mosquito system. So a vector intervention prevents transmission to humans, and a human intervention prevents transmission to mosquitoes. And if you look at what these are, let's say we have conventional campaign strategies, and this is basically strategies that are implemented by ministries of health. If you have treatment of people, whether it's active or passive, whether IPTP or IPTI, this is treatment of pregnant women and treatment of children. if you have passive case detection, whatever you do to treat human beings, you're taking those parasites out of the human system and therefore preventing them to come to the mosquitoes, right? If you use bed nets, indoor residual spray, or larval interventions, you're preventing that transmission to humans. So you can see each of these systems, each of these interventions function in different directions. If you're doing possibly supplementary community-based strategies, you can see what can be done. For example, you can have active case detection, community empowerment, and so on. And for larval source management, spatial repellents, community education can all prevent transmission to humans as well. As Leo mentioned earlier on, all these slides are available to you. So if you're frantically taking notes, don't stress out. You can get all these slides later on. So an important point in this, and the reason why I do this is because if you have transmission at your site, even though you've done a really good job at giving out bed nets, just realize you might be able to prevent more transmission by focusing on transmission in the opposite direction. So if you have really good vector control interventions and really good human-based interventions, you're actually going to get the maximum impact on malaria transmission you can get. And if you're not doing one so well, if you cannot do it so well, try and complement it or supplement it by really good interventions in the other direction. So, your vector plus your human interventions should have a better impact than just one alone. And sometimes, no matter what you do, I'm going back a slide, if you're doing all these interventions super well and you're doing a really great job, and you still don't have malaria going down, and you're like, what is happening? I'm doing such a great job, right? Now, the next slide is about that. It is called the Bayer curve, and it is on the y-axis, you have malaria prevalence from 0 prevalence, which we all hope for, and 100% prevalence, where everyone has malaria at that time point. If you look at annual EIR, and EIR stands for the entomological inoculation rate. This is the number of infectious bites a person gets per time period, let's say per year. In this figure, it is per year. So this means the 600 means that if I lived in that area, in 1 year, I would get 600 infectious bites, which means I would be infected with malaria 600 times. And if you think this is really high, it is quite true and possible in a lot of places in the world. So you can see this line here, right? So let's say if I have an EIR of 600, I should have about 90% prevalence. So 90% of my population should have malaria at that point in time. Let's say I do a really good job at vector control and I reduce the EIR by half. That's a gigantic, really great job, right? That's a gigantic drop by 50% to 300, from 600 to 300. You still don't get that big an effect. It's about 85% prevalence. So you dropped EIR by 50%, but your prevalence just goes down 5%. And let's say you do an even better job and bring it down 4 times to 150 infectious bites per year. Your transmission just becomes about 80%, 78%. This is not that great, but this is because imagine you're being you're getting an infectious bite 150 times a year, which is true of many places, which means no matter how much you treat that person, they're still getting infected with malaria, right? But there comes a point in time, right around this orange circle, when a small decrease in the EIR has a big impact on malaria, right? So a lot of us, for example, may possibly in Nigeria and the DRC, were at this part and the top part of the graph, where even though we might be doing a really great job, we don't see a significant impact on transmission. And our jobs are to get that EIR low enough into this little orange area where a small decrease in the AIR, a small increase in how we're functioning can have a big impact on disease. And this is where we start seeing ourselves move towards elimination. I hope that sort of helped you all understand why, even though you might be doing a really great job, you might not be seeing that great an impact on transmission. But the messages keep doing that really great job because you are impacting transmission. You might not see it in terms of prevalence, but you are impacting transmission. The next concept is mosquito behaviors and interventions. Why are mosquito behaviors so important? So let's look at this figure here. And over here, we have a little open hut, and there are people inside, people outside. There's a cow around, and you can see a bunch of mosquitoes flying around, right? Let's say we have three species there. Species one feeds outside and likes to feed outside, and different species have different behaviors. Species 2 feeds inside and outside, while species 3 prefers to feed inside. Now, interventions take advantage of susceptible mosquito behaviors. You have to remember this. Interventions take advantage of susceptible mosquito behaviors. For example, bed nets here. What behaviors do bed nets take advantage of? Humans have to be indoors and under their bed nets to be protected. If your mosquito bites outdoors or early in the evening before people go under their bed nets, the bed net is not that effective. IRS takes advantage of indoor resting mosquitoes. If your mosquitoes do not rest on those sprayed walls, your IRS will not impact those mosquitoes. So let's go back to our initial figure. Right there, outdoor biting, indoor and outdoor biting, and species 3 that likes to bite indoors. Now we put our intervention in that indoor space, bed nets and IRS, and you can see just from this figure, everything that is not being covered by the black IRS L-aligned square will not be impacted by this intervention, right? So see, species 3 that likes feeding indoors will be most effective. Species 2, less effective. And species 1, probably not that affected whatsoever. So your intervention is going to function only in the black space. And this is really important because a lot of times interventions only work so far, as you can see in this figure, and everything outside that is resulting in every single case that you see. So what is a gap in protection, right? We just went over how vector control interventions target mosquito behaviors, right? So when the human behavior and the vector behavior overlap, we have a gap in protection, and that is where we have transmission in the central green. This is where all our transmission is happening. Now we take an intervention, for example, bed nets, and we overlay it onto the system, right? Your intervention is not going to work in every single place and time where humans and mosquitoes overlap. So where they all three overlap, you get protection. And where the intervention doesn't overlap, you have a gap in protection. Just go back to this figure, right? It's the exact same thing. You have gaps in protection and protection. And understanding this, where and when you are protecting people at your sites, and where and when you cannot or are not protecting people at your sites, is exactly what we want to do. And this entire course is sort of based on that. How can we use the entomological surveys to understand what to use, how to use it, when to use it, what we cannot do? So just remember this figure because I'm going to pop it up a lot. You're going to see this figure a lot. So now we actually have mosquito behaviors, your human behaviors, and interventions overlapping, right? You can see see it in this figure. The really frustrating part is we are dealing with live systems. We're dealing with humans who change a bunch of things and vector behaviors that change. Let's say we have three kinds of vectors at our site. One vector that overlaps with the intervention a lot. For example, the one that bites indoors with bed nets. One that doesn't overlap so much. For example, one that bites indoors and outdoors. And a third one that bites outdoors that doesn't overlap with the intervention. And just from this figure, you can see what will be most impacted. Your vector A, right, his population will probably go down because you're targeting it so well. Vector B will go down, but maybe not so much. And vector C will not change at all. So one of the things we have to remember whenever we implement an intervention is that we've changed the system. We've changed the transmission system, as you could see in this figure. And understanding how that transmission system changes will allow us to adapt and respond appropriately. The second thing that can change is these vectors can change their behaviors. So let's say it overlaps with the intervention that much. Over time, we're selecting for interventions that don't overlap as much, selecting for mosquitoes that don't overlap with the intervention. For example, if we have bed nets and late night feeding mosquitoes, the mosquitoes might start feeding in the evening because those are the ones that survive. So we want to watch out for how these mosquito behaviors change. And of course, the third thing, which we measure all the time, is insecticide resistance. As insecticide resistance develops and spread, we can have the vectors move outside the scope of that intervention. And then we might even have the mosquito population even grow, right? Because now they're not being killed off by that insecticide. So the three things we need to watch out for whenever we implement an intervention is changes in species composition, changes in species-specific behaviors, and changes in insecticide resistance. So just as a quick summary to what I just said, malaria transmission is determined by local vector species. Different species have different behaviors, and the species-specific behaviors and the species-specific compositions at your site will determine how your sampling works. And I will go over this in another presentation because your sampling method also takes advantage of mosquito behaviors, and mosquitoes have different behaviors. The species-specific behaviors and compositions will tell you where and when malaria transmission happens. It will tell you the potential of an intervention, if a specific intervention will work at your site, and you can also use it to evaluate your intervention. That was a short, brief talk about on the importance of entomological surveillance. And because of this, entomological surveillance can be used as the intervention, sort of, as you're taking your heartbeat on your wrist, right? When you can feel your heartbeat, you can use entomological surveillance to understand what's happening in your transmission system, how your humans are functioning, how the vectors are functioning, and how your interventions are functioning, right? It tells us the drivers of transmission, the potential of intervention, and which ones to select. Especially nowadays, we have novel interventions coming up, like spatial emanators. Like, are they appropriate for my site? It'll tell us how to evaluate an intervention, how to optimize the intervention, the drivers of residual transmission are what you are not protecting, where every single case is coming from, those gaps in protection, as well as it'll tell you how to monitor changes in your transmission system, whether your mosquitoes are changing, their populations, if you have a new invasive species like Anopheles stevensi, or they're changing their behaviors or insecticide resistance. And based on that, it'll tell you how to respond, right? Because you'll know exactly what's happening. You can respond to that system appropriately. So that was the first presentation I had. And I will quickly pull up my second presentation and we can go on with that. I have to find, as usual, I'm a mess. I'm trying to find where the share button is. I hope that was useful. Please think of and share questions, and we will get to them as soon as we can. So my second talk here is an introduction to the entomological surveillance planning tool, which is the ESPT. I'm basing almost this entire talk on the ESPT because, and I'll go over why. We start off with what is the ESPT? It is a decision support tool. It helps us to plan, interpret, entomological surveillance, and it helps guide programmatic vector control decisions. And just from that, you can see why it's really important, right? It uses WHO and PMI guidance. So both WHO and PMI have input into this. And it's really important because WHO asks us to collect so much data. And if whoever's on this call, if you have country data, ask yourself, are you using 100% of that data to make decisions? And I'm pretty sure the answer is no. So what the ESPT does, it narrows down the focus of what you're doing. It uses PMI and WHO guidance and on exactly what you're trying to answer. It focuses it on decision making. It is practical and question based and cost effective. And I'll go over why question based entomological surveillance is so important. It also integrates multiple kinds of data, not just entomological data, right? Human data, human behavior, epidemiological data, and so on. If you Google MEI and ESPT, you can see down there, there's a PDF document. And please download that document. Even though I'll be referring to it every now and then, and you don't really need it for this course. But if you do have it, it would be really great for you to, like I might say, look at this figure or look at that figure on this page. It would be helpful for you to do that. But honestly, you don't have to download it. I will be presenting everything you need to do, and I'll be referencing to the ESPT when on certain slides, just so that you know it's available there. We also have YouTube videos. If you go to YouTube and at Global Health Sciences, we have a bunch of YouTube videos going over every aspect of the ESPT. And you can see Mercio Pio, my good friend and colleague, is the one presenting. And we also have a little ESPT, which is an electronic ESPT, which you can download for your computer and work on it off your computer. And that's also available there. And the really cool part is that at the end of working through, for example, an ESPT, you have a question and you go through this online ESPT, it gives you an output which tells you what your objectives were, your minimal essential indicators, your sampling methods you use, and what analytical techniques were needed. And of course, this is just a one-page screenshot, but you can take this document and edit it and show it to your boss. And if he says, why do you want to do this? You can say, well, this is exactly why I want to do it. This is my objective, and this is exactly why I want to measure these things in this way. It's actually quite useful, especially when you want to make multiple sort of ways of doing entomological surveillance, and you can see the pros and cons to each one, and then present them to your boss or make up your entomological surveillance yourself. So MPAC, which is the Malaria Policy Advisory Committee, said, and we all know this, right? As malaria control improves, the underlying heterogeneity in malaria risk is revealed. This means malaria transmission drivers is not the same everywhere. This means instead of a one-size-fits-all approach, we need a problem-solving approach. We need to figure out what intervention package is most effective in what site. It's within a country, right? And we need to be flexible in how we implement this. And this is what resulted in the ESPT. And this is really important, especially now, since about 45 or 46% of the world's funding disappeared. All of us need more funds, and it is really important and relevant now because we need to focus in our efforts with less funds and get more data, basically. We want to eliminate malaria. So the objectives of the ESPT is to support gap filling in operational guidance. So the ministries of WHO has all this guidance, but it's not necessarily relevant and focused in on what you want to do at your site. It's not relevant, specifically relevant to exactly what you need. And the ESPT helps fill this gap. It makes global guidance from WHO and PMI applicable to your site. It uses minimal essential entomological indicators, the essential things you need to measure, and just that. You don't need to do any more than that. They are actionable and collectible, meaning you can actually act on it. And it also integrates, of course, multiple kinds of data. Who can use the ESPT? This is the shortest slide, I think. The answer is everyone, for anyone. I actually use it in my research and making research studies as well. The entomological concepts, the ESPT is based on a few entomological concepts. And the first one is that entomological surveillance should be question-based. what is the question you are trying to answer? Think about that. The second thing is that mosquito behaviors function with interventions based on how the intervention functions. And I went over this earlier on, right? The third thing that is super important is that human behaviors are super important too. With entomological surveillance, we focus in on entomology and mosquito behaviors and what mosquitoes are doing. However, when we're looking at malaria transmission and we want to reduce malaria transmission, we have to focus on humans because sometimes, as you might know, they are the problem. Minimal essential indicators. As I mentioned, we don't have to collect every single indicator, just the ones that answer our question. Non-entomological data might be really important to collect, such as temperature and rainfall, human movement, things like that. Those are important to measure. And and one of the most important part is that your transmission system is dynamic, not just between seasons when mosquito populations change, rainfall comes, it gets hotter, colder, wetter, wind patterns. Transmission systems are dynamic, and understanding this over a season is super important. Understanding it over years, over climate change is also important. So those are the six sort of background concepts that the ESPT is based on. And moving through the ESPT, there are these steps, and I will be going through most of these steps. This has actually helped me a lot when I function with research, not just programmatic research, but like academic nerd research that I do. Uh, it starts off with what is your question? And based on your question, you will select the indicators or the measurable endpoints that can answer your question. Once you know which indicators you want to collect based on your question, you will choose the appropriate sampling method to collect the indicators to answer your question. Once you know your sampling method, you will look at what sites you want to collect the data from. And of course, this is based on your question and your sampling design that will give you the data that will answer your question, right? And once you work through this, so you ask your question, get your indicators, figure out your sampling methods, figure out your sites and your sampling design. And once you have this ideal study, my next step is to see if I can actually afford it. Do I have the money? Do I have enough people? Do I have enough vehicles? Do I have everything I need to do this idealized study to answer my question? And then, based on that, I will redo this. I will go through the entire thing to make it fit my budget and capacity. So, in the end, you have the best entomological surveillance possible that fits within your capacity and funding to answer your question. And you can make your programmatic decision based on it or answer your research question based on it. Another concept is a decision tree. I know this is an empty slide, but imagine you are trying to figure out what to do for dinner, right? You're basically going through a decision tree. So my first question is, by the way, a lot of my examples are based on food because I love to eat. Uh, my first question is, what do I want to eat for dinner, right? And let's say it's like either fried chicken or soup. I'm completely making things up. So the question is, do I have fried chicken at home, right? Yes, I can eat at home. Oh no, there's none. So I might have to go out, right? And if I have to go out, it's like which restaurant do I go to? Option one or option three or option two, right? If there is chicken at home, do I need to cook it or do I just need to warm it up in the microwave? So at each step, you have a question and an option. And this is actually how I function with my research. At the beginning question, for example, what is the species composition of vectors at my site? I put out every single option that I can do. And even though it might sound complicated, it helps you think through everything so you're ready for anything. And in the end, you actually just function like this. It's just a few boxes. Do I have any chicken at home? Yes. Right? Is the chicken cold or do I have to warm it up? It's not cold. I can eat it straight away. I completely made that really bad example up, but you can see. But at the end of it, you've realized you've thought through every option for entomological surveillance or eating fried chicken. But this way, I hope you get I hope you get it. You can actually function with decision trees, factoring every single option that you might have to face. And this simplified decision tree here with no questions is represented in this decision tree for indoor resting density. If I want to know the indoor resting density at my site, and this is all in the ESPT, baseline C is the indoor resting density decision tree. And here's my question. Is the indoor resting density known in unsprayed houses and sprayed houses if IRS is conducted? If it's no, it tells you what to do. When you finish doing it, go to two. If it's yes, you go to two. Are they vectors resting indoors? If it's yes, is IRS conducted? If it is yes, that's a problem, right? Because they should not be resting there. If it's no, you might be able to consider IRS at that site. Are the vectors resting indoors? No, right? Is IRS currently conducted at site? Yes or no. So you can see going through these decision trees can help you sort of understand everything to do with your question. And this question is there indoor resting mosquitoes? Or another question that might fit this decision tree is IRS an appropriate intervention for my site? Right? Do vectors rest indoors at the site? At the bottom, you can see example questions for this decision tree. If IRS is currently implemented, is it having an effect on indoor resting density? If IRS is not currently independent, should IRS be considered for this site? And there are multiple decision trees there. When you download the ESPT, you can see them, and they're decision trees for almost every, not for almost, they're decision trees for every entomological indicator. If you have questions on this, there you can please email any of us. Mercy is based in either Barcelona or in Mozambique. Elodie is in Norway right now, and Eddie is in Atlanta. So our team is global, and we are happy to approach you, happy to answer any questions at any point in time. My next slide set, this is the only slide set, but I put them together because they weren't that long. Is on, yes,
Neil, can I, sorry to
of
interrupt.
course.
So we're 4 minutes short of the 45 minutes suggested lecture
Okay.
length. So you can make a decision, carry on for 4 minutes, or we can have a break from here for 10 minutes. Which would you prefer?
Let's have a short break and then we can continue.
All right. Okay, that makes sense. So
Yeah.
everyone, thank you for that, Neil. Wonderful, wonderful information being shared in a wonderful, wonderful way. Compliments coming from everybody in the chat box. So let's have a 10-minute break, reconvene. It's now 12 minutes past, so maybe 24 minutes past the hour. 10 minutes from now, let's reconvene. Uh, See you all a bit later, everyone. Come back, hey, don't drift away. Come back. Bye-bye now.
Yeah. Thank you. See you in 10 minutes. And thank you for interrupting me, Leo.
Neil, according to my watch, we're 10 minutes down. Are you about ready?
So
Are
far.
you about, are
Yeah.
you okay to continue? Okay, thank you everyone. Hopefully you did manage to have a break and did what you needed to do. So handing back over to Neil. Thank you, Neil. Back to you.
Hey all, I hope you all had a good break. I will start sharing my slides again. Oh, wait. There we go. Can you share my screen? Can you see my screen, I mean? I hope you can. Cool. So my next slide set is on gaps in protection. It's a short slide set after I start off on longer slide sets. So what is a gap in protection? A gap in protection, and this is our definition, is a circumstance when an individual or a household can be exposed to malaria infection, to an infective mosquito bite. And this is because there is a lack or there isn't something to prevent that. There isn't an intervention that will prevent that exposure to mosquito bites. And again, you can see the figure below, and you can imagine where the gaps of protection are because you have seen this figure earlier. So here's an example. And I'm going to preface the example with something I say a lot. A lot of people will say, I have 80% bed net coverage and 90% bed net usage, and I'm doing such a great job. And I believe that. I believe you're doing a great job. But my question is, so why do you have so much malaria? Right? And if you look at the previous slide, I think you totally understand why you have so much malaria because there are all those gaps in protection. But from an intervention perspective, how do we understand that? And to understand that, the first thing we want to understand is how does that intervention work? What is its MOA, its mode of action? So let's go through this for bed nets. Bed nets function on late night indoor miting mosquitoes, correct? And this is the proportion of biting that bed nets can reduce. For bed nets to be effective, humans have to be indoors and under the nets. If they're not indoors, they're not going to be affected. They're going to be bitten. And mosquitoes have to be susceptible to the insecticide, right? If they're resistant, they're not as impacted. You won't get that community protection. So the intervention functions on based on how the intervention functions and what humans are doing and what mosquitoes are doing, right? And we can measure this. It's not hard to measure. To me, the more important part, right? Because the left side of this tells us how we're protecting, the right part is what we're not protecting, how bed nets do not function. And for everything that outlines how it functions, there is an equal, well, not necessarily equal, but there is a gap in protection. Bed nets do not function on early evening or outdoor biting mosquitoes. If humans are not on the bed nets, they're not protected. And mosquitoes might be resistant to the insecticide. So just in this figure, if we understand the left side, we can understand how we are protecting people. And if we understand the right side, we understand the gaps in protection. And on the right side is where every single malaria case comes from. The right side is what we want to reduce. The right side is what we need to focus on to reduce those malaria cases. So understanding the gaps in protection is actually super important to me. Now, when we look at available interventions, right now we have in blue bed nets, which is a core intervention, IRS, which is a core intervention, and LSM, or larval source management, which includes larviciding. Please note that larviciding and larval source management are actually different in the field because larviciding is short term and you keep having to go back, and larval source management, where you eradicate certain features in the landscape and reduce larval sites, can be more permanent. So we function with them differently. But that is a whole nother day of talks, which we're not going to go there. Uh, Spatial emanators or spatial repellents are recently uh, uh, have been recommended as a conditional recommendation by WHO. So what we would do, what we should do is understand, if we go to the previous figure, how bed nets work, how bed nets don't work, understand how these function within your system. Because you have different mosquitoes, you have different humans. How do those function with the internet? So you'd, based on the modes of action, based on what's happening at your site, you can understand the potential of the intervention, how effective it might be. You can evaluate its efficacy, and as well as how the system responds. Do you change the mosquito populations? Did insecticide resistance come up? Do behaviors change, right? And at the same time, if we understand how the intervention does not work in your system, right, based on the MOAs, you'll understand the gaps in protection at your site related to vectors, related to humans, or anything else. There are, of course, multiple other interventions that are being evaluated right now, but at present, the blue interventions are the one which most of us are working with, and hopefully the yellow ones, spatial eliminators, are an option now. And you can actually use entomological surveillance to understand the potential of spatial eliminators at your site, as well as evaluate it if you do happen to have a study or a proof of principle study. If you do want to evaluate spatial eliminators, let me know. We're actually developing things around this to try and figure out how to relate entomological indicators related to spatial repellents and epidemiological outcomes. Again, I'm back to this figure. Just remember, you can apply this figure to any intervention at your site. Of course, replace ITNs with SEs, spatial eliminators, or with IRS or anything, and try and put this down so you can measure how they work and how they don't work. So when we look at how ministries of health function, to me, this is something that is actually really important. And this is the main question we want to ask. What are the gaps in protection at my site? Where is all the malaria coming from? And to do this, we have to understand how the interventions function, what the mosquitoes are doing, right? Because they're going to be impacted by that intervention, and what humans are doing, because humans impact exposure, where and when mosquitoes are biting them, right? This tells us how much we're protecting, as well as the gaps in protection. And these two tell us how effective our interventions are and how to optimize our interventions, how to make them better without additional cost. And the gaps in protection tell us the sources of residual transmission, as well as what other interventions might work best in our space. Just from this simple diagram, you can see what's happening at your site, and this will tell you what you can do to make your intervention measures better. And that was my short presentation on gaps in protection. I will now start off with a presentation on questions. Hold on one second while I get that slide set up. There we go. Actually, I have to move this to another screen because that screen was too full. There we go. Question-based entomological surveillance. This is super important. What is your question? Oh, hold on one second. It is not moving. Let me... My slide set is not moving. Now it is. Haha. So for this is the first slide set in focused in on the ESPT and entomological surveillance. We'll go over why question-based entomological surveillance is important and how to identify and formulate programmatically relevant questions. At the bottom, you can see the different parts of the ESPT or the logical flow that you want to go through with entomological surveillance. And the first step is, what is your question? The next step is indicators that will answer your question, but we are here right now. Question-based entomological surveillance must be guided by a specific programmatic relevant question, because your question will inform decisions. We don't have enough money, we don't have enough time, we don't have enough capacity. Let's focus in on what we're doing. Why are we collecting this data? What is the question we need to answer, right? And the question will shape everything. It'll tell us which indicators we want, how to sample it, right? Let's say my question is, which mosquitoes are biting humans at my site, right? I'm not going to be using a cow-baited trap. Just that simple example will tell you the question tells us what trap to use, right? So here, the question determines everything we're going to do at our site. It is the first step in planning entomological surveillance. And towards this, we've sort of grouped questions into 6 parts, and this is just an example slide set of questions you can ask. You do not have to answer any of these questions, but all these questions just can sort of give you an idea of how to formulate a question at your site. We're going to look at current vector control intervention performance. Are we trying to evaluate how the intervention is functioning? And under this, we can ask multiple questions. And you can see we'll go down each question, type of question, and we have a couple of example questions in each of the slides. It's not a long presentation. So we want to evaluate intervention performance at our site, right? So a question we can ask is, how does the current intervention at my site impact vector species composition? And of course, malaria over time. And in this question, we would look at what vector species are there and relate it to epidemiological data, which is not entomological data. So over time, we would want to look at vector species, what's happening when we put the intervention in, and what happened to malaria. This is just an example question. Our next question is, are local vectors susceptible or resistant to the insect, to our bednet or to our IRS, depending on the chemical we use? That's a good question to evaluate vector control performance. A third question is IRS effective in our area based on the vector behavior, human behavior, and insecticide susceptibility? Is IRS effective? Are the mosquitoes, again, a key indicator we would use here would be, are the mosquitoes resting on sprayed walls, right? So just based on these questions, 3 questions, we can, 3 example questions of how to formulate a question for entomological surveillance. If we are looking at selecting or evaluating a supplemental intervention, for example, we have bed nets. We want to see, should I put in spatial emanators or should I do larval source management? We can ask a bunch of questions. For example, what are the gaps in protection at our site? And which interventions might fill those gaps? For example, with bed nets, if all the remaining transmission is happening outdoors, you probably don't want to use IRS if your mosquitoes are not resting indoors. So you might want to use something else. Another question is, what is the baseline vector composition, distribution, and behaviors before putting in an intervention? And you'd want to do this to understand if your intervention is working well at our site. Another question is, when should we use a supplemental intervention? When should we put it in? Beginning of the rainy season, end of the rainy season, right? And your data, your entomological surveillance data will tell us this. And of course, once you put in an intervention, it will impact species composition, behaviors, and insecticide resistance. And a question could be, how do the vector populations change after putting in that intervention? A third subset of questions would be trying to understand what is driving transmission, what is supporting transmission, what systems in place at your site are actually increasing transmission, right? And a question could be, what are the potential entomological drivers of malaria transmission at our site? And this can be based on vector behaviors. For example, all our mosquitoes are biting indoors and we have no bed nets. It could be species composition because you have one very, very, very good vector and maybe 12 not so great vectors. So ignore those 12 and focus in on that one. Maybe the mosquitoes became super insecticide resistant and your bed nets or your IRS is no longer working, right? A driver of transmission could be human behavior, right? For example, you gave everyone bed nets, and I work at sites where people do not like using bed nets. So everyone has a bed net folded up neatly in their house. So does human behavior affect the intervention effectiveness, right? So that's a great question to ask. Then again, you can ask, what is the association between vector populations and rainfall and malaria? And based on that, you can time your intervention deployment, right? So that's just another way of asking questions to try and understand the drivers of malaria transmission so you can make specific decisions. Please note that each of these questions is focused on a decision. Let's say you have reduction in funding. That's me. I've read a reduction in funding, and hopefully not you all, but I assume everyone has a reduction in funding, right? Now you've been collecting a ton of indicators, right? So what indicators, what are the minimal indicators to collect? I don't have enough money. I want to focus on the most important data. What are the most important indicators to collect based on my vector control strategy, right? What are priority surveillance activities should I focus on? I have less funding. What activities should I conduct? What activities should I let go because I cannot afford everything? What entomological surveillance activities can be conducted with my current budget? I only have $20 or maybe hopefully more than that, $100,000. What should I focus on? So these are questions you can use in the ESPT or to guide your entomological surveillance. Let's say we have a site where there is not much malaria or it's completely eliminated, and I hope that's all of us pretty soon. So prevention of reestablishment of malaria is POR. What do I monitor to prevent this, right? Do vector populations change over time? When are the most susceptible times? Malaria has gone down a ton. It's eliminated. What do I have to focus in on with very limited funding to make sure it doesn't come back? And as you can see, there are multiple questions we can ask in this setting. And of course, there are questions that have nothing to do. They're sort of a random assortment of questions we can ask to enhance or tailor our surveillance activities. For example, if your country does not allow human landing catches, can a CDC light trap be used as a valid proxy? Because one of them measures human landing rates and the other one measures something different. We're not using humans and landing, right? We're using a trap that uses light and a bait. So are they the same? Does the data reflect the same endpoint? Does the data reflect human landing catches or human biting rates? Sorry. Another question is, let's say you're focusing on Anopheles minimus in this area or Dirus. Can we rear it in lab for a susceptible strain for insecticide resistance testing? That's another question to ask. And of course, if you're in an area and you're not sure of what trap to use to collect mosquitoes, because different traps work differently with different mosquitoes, and the same trap works differently with the same species from different areas. I know that was confusing, but I'll go over that in a bit too. So, which is the most effective trap to use at my site? That's another question. So when you're asking a question, and again, please start off with your question. Try to consider things like the case data and recent trends. Was there an outbreak? What are other risk factors? Was there a tsunami? Well, hopefully another tsunami, but was there a hurricane? Or think about things that might impact your question. And specific decisions might need to be made on the selection, procurement, and targeting and tailoring of vector control interventions, right? So consider all these things are related to annual work planning. For example, if it takes a year to procure your insecticide for your intervention, then you might need to start a year before you actually make that decision, right? If your country wants to procure bed nets and it takes 8 months to procure bed nets, you need to get the data before that, because if you collect the data today and it's really important, you cannot procure countrywide bed nets tomorrow. You have time, so timing is essential. And your question directs everything. This is super important. That's the end of that slide set, so please be patient with me while I switch slide sets. And the next slide set on indicators is actually kind of a long presentation, and I'm pretty sure we're not going to finish it today. And while I try and find it and pull it up, I am going to have a sip of water because my throat is rather dry. Excuse me. Can you see my screen?
Yes, we can see it.
Yes, thanks, Neil. Thank you.
Sorry, sip of water. Yes, and thank you. So now that we have our question, the next important step is to figure out which indicators answer our question. Where are we? We are right there. We've asked our question. We know what question we want to ask. Now we have to figure out what answers our question. This is just like cooking. What do I want to eat? Fried chicken. What essential indicators or what essential ingredients do we need? It's chicken, oil, all those things. So exactly what do we need to make fried chicken? Not fried chicken. Gosh, my mind's on fried chicken. What exactly do we need to answer our question? So we have to align our indicators with the question, obviously, right? Excuse me. So how do we select the minimum essential entomological indicators, right? And I went over how we collect a lot of data and a lot of it goes unused, and all that money and effort is basically wasted, right? It is critical to focus in on identifying, first of all, and then collecting these indicators. Now, over here, I have a list of indicators. It's a minimal essential list that we made. And the first one is vector occurrence, vector density, seasonality, biting behavior. And the biting behavior is, are they biting indoors or outdoors, which is the place, and what time they bite. Do they bite early in the evening or in the middle of the night? Resting location, are they resting indoors? And I know you know what that is. Resting indoors is important for IRS, right? Insecticide resistance, and this is the status, is it resistance or not, and the intensity or frequency. We have receptivity, which is the presence of larvae, which means your site is receptive to malaria transmission. Are the habitats there? Are they occupied by larvae? And of course, your larval density. Now, this is not that many indicators, and you might think, whoa, I don't want to collect all these, and I completely agree. You do not have to collect all these. You collect them based on your question. And simply, let's say we look at IRS. How does IRS function? IRS functions on indoor resting mosquitoes. Basically, you spray those walls with insecticide, the mosquito lands on them, and they die. And the mosquito will only die if it is insecticide susceptible. So the most important indicators, the minimal essential indicators on this list would be, I'll give you 3 seconds to think about it, only those. The only thing you need to know if IRS is going to be effective is the proportion of mosquitoes resting on the walls and doors and your insecticide resistance. And that's it. You don't have to collect anything else. The cool thing is, if you design your entomological surveillance well enough, if you design it in a manner that collects these two indicators passively, just because you've designed it well enough, without any extra money, you can collect all those indicators. So you can get a more comprehensive understanding of what's happening at your site without doing much of without making an extra effort. For example, you can collect the resting mosquitoes over time, over a year, and you'll understand seasonality and you'll understand exactly when to put in your IRS to maximally impact your mosquito populations. And you can use basically vector density and seasonality to understand that. If you look at bed nets or long-lasting insecticide impregnated nets, it's the same thing. I'll give you 3 seconds to think about this. It's super simple. It's just those two, right? It's an insecticide. Look at insecticide resistance as well as where and when they're biting. Are they indoors or outdoors? Are they biting early in the evening or in the middle of the night? And if you collect your data well enough, if you design your entomological surveillance, you can understand all that as well. It's even simpler for larval control, right? If you're looking at larval control or larviciding, the minimal thing you need to know is which habitats have the larvae, because you're going to treat them or try to do something about them. And if you design your strategy well enough, you can collect a lot more things, a lot more indicators that tell us when to go and do larviciding or when we should monitor for it, for efficacy. And based on these indicators, you can also measure the three important things that might change. And I'll give you again 3 seconds to think about what might change in the system when you put in an intervention. And those are changes in species composition, you have changes in mosquito behaviors, and the emergence and spread of insecticide resistance. So with this short list of indicators, I think there are 40 or so with WHO. You can focus on and just focus on 2 or 3 indicators and answer questions about these major interventions, as well as look at changes over time in composition, behaviors, and insecticide resistance. So you can try and see how using your question to focus in on indicators can completely make your work much easier, cheaper, right? And you actually produce focused data that answers your question and you can make a decision on. Now, this is the part that actually takes kind of long. I'm going to go into each of these indicators, and some of them I won't spend much time on because you're going to get all these slides. All the definitions are on there. And when you can look at the definitions on the slide, I don't have to go through each one of them because they're available too. What is an indicator? An indicator is evidence or data that indicates the status or level of something. And this could be vector species. What is the status? What evidence do we have on the vector species composition, right? As an example, I'll go through each one of these now. So the first one is vector species. The definition is a vector species in an area and proportion of each vector species, right? So 90% of them are Anopheles gambiae or Anopheles minimus or dirus. So that is vector species and species composition. I'm not going to go over the calculation and definitions because you can do this when you get the slide sets or just Google it. Why is this important? So Marianne Sinka had this publication where she did a modeling exercise of what are the primary vectors present all over the world. And each color represents a different species. And I know all of you know that you find more than that specific species, especially in Asia. It says Dirus SL and Minimus SL. And I know you find multiple sites in this area, multiple species in this area. And your area might actually not have that many of that specific species listed. So getting your data is really important. Getting your own data from your own sites is really important to make the best decision possible. Uh, and as you know, different species have different behaviors. And look at this very colorful slide. It means that all these species listed here have different behaviors. And we know that at each site, there are a lot more than just these one color species. So it's a lot more complicated than just this. And here is an example of why it's so important. This is sort of almost, I'm saying almost made up data because I didn't use exact numbers. But on the left side and on the y-axis, we have the number of mosquitoes. On the x-axis, we have years. Now, each of these represent 3 mosquito species, each color. Green is Gambi, that feeds indoors a lot and likes humans and likes animals, less so animals, but more humans. Phonestus feeds indoors and loves humans. They are very anthropophagic. Arabiensis feeds mostly outdoors and on animals at this site. Please note that these behaviors can change at different sites. The bed nets and IRS were placed over here at the red arrow, and you can see the green is Gambi, the red is Phonestus, and the blue is Arabiensis. And just based on your knowledge on previous slide sets, when you put in an indoor intervention like bed nets and IRS, what might happen? Which species would be most impacted? And this is based on real data. You can see the indoor biting mosquito, the red one, almost disappeared completely over time. The green one reduced drastically, which feeds indoors and outdoors, and the blue one remained the same. Interestingly, malaria went down hugely to around 25 to 35% prevalence. And you can see how how the interventions contributed to the degree, to the species composition differently, right? It impacted each species differently. So species composition and understanding species composition at each year was really important to understand what species was continuing malaria transmission. And right now, as a note, this little blue line about the malaria is going up because there's insecticide resistance and phonesis has come back and hopefully it'll go down again. The second indicator is larvae and larval habitats, the proportion of habitats with Anopheles larvae. This is based on a study in Indonesia, in eastern Indonesia, and you can see my bald head there sampling larvae. And we are numbering them to understand which was which, and it was really interesting because the villages there were basically treating sites like Site 9 in the villages, as well as Site 4. No, I think it was Site 9 and Site 19. And the places where we actually found larvae were the other ones in these little pools, in this right here, number 4, and entire tracks actually had a ton of larvae. So knowing which larval sites actually have the larvae, sorry, which water bodies actually have the larvae, which are larval sites, is super important so you target your larviciding appropriately. Receptivity is just the presence of Anopheles, and obviously we all have Anopheles or we wouldn't be here, and I hope you don't, which means that you would not be receptive to malaria transmission. Seasonality is important because this tells us when there's the malaria season, and usually there are specific non-entomological drivers of the mosquito population. So something will enable mosquito populations to rise and give us more malaria. In this example, this completely made up example, we have rainfall in orange, and we can see as rainfall goes up, so does the mosquito population. And then based on your rainfall, you have your transmission season. And usually I would ask, at what point do we put in our intervention to reduce malaria? And it would normally be right around before everything starts going up. So we can reduce that infectious reservoir. If you remember that malaria goes in two directions, humans and mosquitoes, you want to reduce that before it gets too high, in both directions, hopefully. Endophagy versus exophagy. Endo means inside, phagy means biting, exo means outside. So indoor-biting versus outdoor-biting. What is the proportion of mosquitoes biting indoors or outdoors by species? By species is an important part, right? And this is important to know because a lot of the time we have indoor interventions. And this is, again, a completely made up graph on number of mosquitoes on the y-axis and the time of the night on the x-axis. The orange line is the number of mosquitoes biting outdoors, and the blue line is number of mosquitoes biting indoors. And over here, it looks like that the mosquitoes are biting people outdoors when they're outside, and as people go inside, they start moving indoors and biting more. But this also could be two different species. So understanding this will tell us where and when the mosquitoes are available to bite human beings at that site. Here's an example of why this is important. So in the 1970s, on the left side of the figure, again, on the y-axis, we have numbers of mosquitoes, and on the x-axis, we have the time of the night. 24 is midnight. So at midnight, indoors, most of the mosquitoes were biting. By 1971, they were still biting mostly indoors. This is a couple of months later, seasonality. And then they started DDT spraying. And DDT spraying impacts indoor mosquitoes. Post DDT spraying, what happened was the mosquitoes were biting less indoors, less in the middle of the night and more early in the evening. And in about 2011 to 2015, the Ministry of Health wanted to know, so we're giving everyone bed nets, we have IRS, why is malaria not going down? So we did this like really cool study. I thought it was really cool, where we used mark release recapture mosquitoes. We'd mark them with fluorescent eyes and let them go and see where they came back. So we'd mark indoor biting mosquitoes and outdoor biting mosquitoes with different colors and let them go and see where they came back. And what we found is that, again, the biting rate is on the y-axis here, and the time of the night is on the x-axis, and the solid line is outdoor biting mosquitoes early in the evening, and the dashed line is indoor biting mosquitoes. And the data suggested, this is the evidence, the data suggested that even though indoors, everyone had a bed net to sleep under, and there was IRS killing those indoor resting mosquitoes, 84% of the biting occurred when people were outdoors and unprotected. So the mosquitoes had changed their behavior to bite outdoors. So we had outdoor transmission. And answer this to yourself. Do you think the indoor interventions, IRS and bed nets, would eliminate malaria at these sites? The answer is no, because now the transmission has moved outdoors where we didn't have an intervention. And at present, I'm pretty sure malaria has gone up in the Solomon Islands. So something else is happening. Indoor resting density is the proportion of mosquitoes resting indoors by species. Please note that all these entomological indicators are by species, so pay attention to that. And when you collect data, do it by species. It's really important to understand that. And as you may imagine, indoor resting density is based on which intervention? IRS, correct? So understanding the indoor resting density is really important when you're trying to figure out what's happening with IRS or the potential of IRS at your site. Now we have insecticide resistance that we know. and that we all know of, I'm sure. And this is a proportion of mosquitoes that are resistant to that specific insecticide, again, by species. There are WHO bioassays available and CDC bottle assays. And depending on your insecticide and the availability of WHO bioassays, which are really, really hard to get, it's always a struggle to get them. If anyone can fix that, please let me know, because I need a bunch of this at a bunch of sites and we can't seem to get them. Bioefficacy, and this is of the intervention. For example, this is the effectiveness of bed nets against susceptible mosquitoes. So we place bed nets out, and after, let's say, 6 months, a year and a half, 2 years, 3 years, we take away bits of the insecticide impregnated material, the bed net material, and see if it's still effective. Intervention coverage is a really important intervention because a person has to have the intervention to be able to use it. Of course, usage is a completely different thing, right? Because just because they have it doesn't mean they use it. And this is a really important thing, right? Human behavior. So this is the proportion of people that use it. So that's just a brief overview of a few indicators. And here's a question. And the picture on the right actually answers the question, and hopefully you'll guess it. Besides mosquito behaviors, what is a huge predictor of intervention success or failure? Think about that for a second. So here's a little kid sleeping. There's a bed net up and installed, and it's up, and it's really great. But the kid is sleeping outside the bed net. So even though we have an effective intervention, it is hanging up. The child is not being protected. And this is because of human behavior. Human behavior is one of the most important predictors of intervention success, of how we actually implement interventions. And this can be different between men and women, children and adults. It can be job related. There are so many factors that impact how humans behave and how humans behave with the mosquitoes and the interventions. It's not just how they interact with the interventions, it's where and when they are. Are there mosquitoes there? Is there an intervention there? Are they out at a bar late at night that's open with mosquitoes? Guess what? They're not protected, you know? Are they at a funeral service that lasts all night? Do they have to hunt in the forest at night? Right? All these questions can impact how they're exposed to mosquitoes. For example, in Zambia, in southern Zambia, Choma area, uh, a lot of people are outside in cooking shelters in the evening and they're hanging around. They have to cook, they have to eat, and they're being exposed to mosquitoes when inside the house they may have IRS and bed nets, right? So that's an important part of exposure, human behaviors. So human behavior that impacts transmission and intervention effectiveness is something we focus on a lot. And I'm going to go over exactly how that happens in a couple of slides. But if you look at tables 1 and 4 in the ESPT, once you download it and get that, table 1 looks at minimal essential indicators. Table 2 looks at supplemental or rather nice to have indicators. If you have enough money and resources, please collect these indicators. They're nice to have. Table 3 looks at vector control performance indicators. Which indicators can evaluate your vector control. And table 4 looks at human behaviors and other risk factors. These are all in the ESPT. Here's an example, just a screenshot from table 1. For example, occurrence, you have the outcome, and we have why it's important. So if you read through these, you can actually see why each minimal essential entomological indicator is, its definition, what happens, and why it's important. Table 2, here's supplemental entomological indicators, for example, human blood index, right? And what is it? What is the outcome? What is its definition? And why it's important as well. Table 3 looks at vector control intervention indicators, for example, bed net durability, how long it lasts, and why it's important, of course. And table 4 looks at human behaviors and other risk factors. Just looking through these tables will enable you to understand and comprehend a lot of indicators and how to implement them. Again, sleeping or awake time and why it's important. Oh, here's the grossest picture I have on my slide set. This is my leg. And I just saw a laughing emoji. I'll go back so you don't have to look at that. I'll quickly explain what happened. And some of you might have heard this story before. So I was in Eastern Indonesia, in Papua, Indonesia, doing HLCs. Yes, I do HLCs. And I was doing the 12 to 6 collection, and it was 12 at night. And I walk out there all excited to do my HLC. And I sit down outside. I was outside, and there was absolutely no one around because it's the middle of the night. And I pulled my pants up to do my collections. And I'm not joking. In like 10 minutes, I caught like 40 mosquitoes. And then they kept landing on me, and they kept landing on me, and they kept landing on me. And it was crazy. Like, I was trying to get them on every leg. On one leg, they were landing on the other leg. And if you notice, while I was collecting the mosquitoes on my legs, they were landing on my head because, my head is a mosquito buffet. It's completely bald. And I was going crazy. And I was thinking, there are so many mosquitoes biting in the middle of the night. So many that all the malaria transmission is happening in the middle of the night outside. But then stupid me stops and thinks about this. I'm sitting outside alone, getting chewed up by mosquitoes, and absolutely everyone in the village was inside under their bed nets. So for years and years and years, we have been doing human landing catches and saying that is the risk of the local population. Do you think that was true when I was sitting out there? Absolutely not true. Even though we're collecting human landing data, the humans were not there. So there was no one for those mosquitoes to land on, right? So the data I was collecting was not valid to understand the risk of exposure. So what we realized we had to do was actually focus in on what the mosquitoes were doing, as well as what the humans were doing. And that is where we realize we have to, now just to scar your mind so you don't forget this because it's so important, I'm going to make you look at my leg once again. It's awful. And now you may now hopefully will remember why it's so important to link together what vectors are doing as well as what humans are doing. And this will tell us, will relate our entomological data to actually what's happening in the field. It will make it applicable. The data reflects what's happening in the community, not to me sitting out there getting chewed up. So as you know, vector control interventions target specific behaviors. You know this, the same figure again and again. So what we want to understand is this community level, what's happening in the community with those mosquitoes, not what's happening to that human landing catcher or the CDC light trap or whatever method you use to collect mosquitoes. You want to understand what's happening with the community. So you make community relevant decisions. So human behavior is an important component of entomological surveillance. I do not do any entomological surveillance without trying to understand human behavior. Just remember my leg. That has taught me a huge lesson. So hopefully it will teach you as well. Human behavior observations, or HBOs, help us identify when and where people are throughout the night. And based on when and where they are, it tells us how much they're exposed to mosquito bites, right? This tells us the gaps in protection at their site. And if at the same time we're looking at, what time they're going to sleep, what time they're going to wake, when they're awake, if they're using bed nets, if they're not using bed nets, and it'll really, and I'll demonstrate to you how it actually, we can measure the amount of exposure happening in that community. And of course, it's important to realize that this changes over seasons. For example, in the rainy season, everyone might go in earlier, and in the hot season, they might be doing something different. So based on these human behaviors and what vectors are doing, and factoring in things like how human behaviors change over the year, we can actually understand what's happening at the year. So here is how we do this. Now, I'm going to go over this slowly because this can be confusing, and it was very confusing to me because I'm not that bright. So we'll go over this slowly. So let's say here's a house and a human landing catcher indoors, and here's outside and a human landing catcher outside. Let's say indoors from 1 to 2 a.m. We're just looking at 1 hour. Think about that hour when I was sitting outside. We get 20 mosquitoes. And outdoors, we get 10 mosquitoes. So the human biting rate for that hour indoors is 20 mosquitoes per person, and the human biting rate outdoors is 10 mosquitoes per person. This is what we have been doing all along. And these numbers, the 20 mosquitoes per person indoors and the 10 mosquitoes per person outdoors, is what I'm going to be using. This data I'm going to be using for the remaining slides in this small little slide set coming up. This does not change, but what happens to people based on the human behavior will change, and that's important to realize. So now let's take out the human landing catcher, let's take out those mosquitoes, and we have this data. 10 mosquitoes outdoors, 20 mosquitoes indoors. Now we have a few examples coming up with this exact same data. There are 4 people indoors, right? There we go. Let's say the 4 people represent the community. 100% of people are indoors from 1 to 2 a.m., right? The human landing catcher caught 20 mosquitoes indoors and 10 mosquitoes outdoors. So indoors, the community is 100%, which is equal to 1. Outdoors, there is no one, which is 0%. Because there is no one, we take this 10 mosquitoes and multiply it by the proportion of people outdoors. 10 times 0 it is equal to 0, which means the human behavior adjusted biting rate at this site is 0 outside from 1 to 2 a.m. However, let's go indoors. Indoors, there was 100% of the people. So the mosquito biting rate was 20. So 20 times 1 is 100, like 1.0, is equal to 20. So the indoor human behavior adjusted biting rate was 20. I hope that makes sense. So now what happens is, if we do it on a pie chart, there are 20 mosquitoes per person from 1 to 2 a.m. indoors. This is the human behavior adjusted biting rate. Now, we're going to change this up a bit and see how that completely changes things. So we use the same data indoors and outdoors. Now we have 3 people indoors and 1 person outdoors. Maybe that's me, but there's 3 people indoors and 1 person outdoors. Now, when we look at the community, that's 3 out of 4 people. So 75% of people are indoors, and there's 1 out of 4 people total outdoors. So that's 25 of people outdoors. Now we take this 25%, which is 0.25, and multiply it by the mosquito biting rate for that hour. So 10 times 0.25, 25%, is equal to 2.5. The outdoor mosquito biting rate based on human behavior is 2.5 mosquito bites per 1 to 2 a.m. per hour for that 1 hour. The adjusted biting rate indoors is 75% of the population, which is 0.75. So 20, which is the mosquito biting rate, times 0.75 is equal to 15. So the human behavior adjusted biting rate indoors is 15 mosquitoes per person for that hour. So now, if we look at this human behavior observation adjusted biting rate indoors and outdoors, we can see that most of the bites are happening indoors and less outdoors. But it's not 10 and 20. It is 2.5 and 15. And that is based on what humans are doing. I hope you got that. I'm going to take this into and make it slightly more complicated. It's the same data, same data, but now we have the same 4 people. 2 of them are sleeping under bed nets. 1 of them is sleeping but not under bed nets, and 1 of them is outside. Now, this example will tell you how things can be really important and relevant, how this is so relevant. Just remember, this is the same data, 20 mosquitoes indoors and 10 mosquitoes outdoors for that hour. Now, the community indoors, 50%, 2 out of 4 people are under bed nets. So that's 50.5. So when you look at that, these 50% are protected. So 20, which is the biting rate, times 0.5, which is the proportion of people under bed nets, is equal to 10. So 10 bites are averted. 10 of those mosquitoes can be impacted by these people sleeping under bed nets. 10, these are protected. 25% of people, this person over here, is not under a bed net, but He or she is asleep. That's 25%. 25% times 20 is equal to 5. The human biting rate indoors for this hour for people asleep, not under bed nets, is 5 mosquitoes. Outdoors is the same. If you remember the previous example, 25% of people outdoors, 25% times 10 mosquitoes, 2.5 mosquitoes per person for that hour, the adjusted biting rate. Now, here is where things get interesting. Now, if we take this and we graph it out, you can immediately see that 10 mosquito bites right here are prevented by the use of bed nets. 2.5 mosquito bites are happening outdoors, and 5 mosquito bites are happening indoors when people are asleep not under bed nets. Now, immediately you can say, you can take away these 5. You can make this whole thing mosquito net checked over here by increasing bed net use. So just from this easy, simple figure, you can see I have bed nets at my site. 25% of people are not using bed nets. Let's do an SBCC campaign, a social behavior change communication campaign to increase bed net use. And you can immediately reduce, what proportion is this? It's more than 25. Let's say, what is it? I can't do math, but this proportion of bites you can immediately remove, and only remaining transmission will be in this 2.5%. So you can see how the simple data, how valuable it can be. And now if let's say I take out the bed net part, the 10 bites, and if this is protection and this is exposure, if I take out the 10, what I will see is that. And these are the gaps in protection. Most of the exposure is happening indoors, and there's less outdoors. 2/3 of exposure is happening indoors, which we can technically remove by increasing bed net use. So you can see how important this is. Now let's make this even more complicated. Please don't hate me, but you can see how simple it is when we just incrementally increase our understanding. We have one person awake inside, one person awake outside. We have one person asleep, not under bed nets, one person asleep under bed nets. I'm pretty sure you can do this on your own. There's 25% in each category, right? And you can see we multiply that percentage by the number of mosquitoes there, multiply that percentage by the number of mosquitoes there, and you can see that this is what happens with all our data. About 25%, approximately, slightly less than that, I think, of bites are being prevented. But guess what? The blue is people awake, not under bed nets. So that means they're awake. We can't give them a bed net. What do we do about them? Perhaps we can give them an intervention like spatial emanators, right? Or maybe topical repellents or something like that. The 5 that are awake, sorry, the 5 that are asleep, not under a bed net, the 5 bites that are happening there, we can increase bed net use. And outside, we'll have to think of something else. So just based on this figure, you can see what you are protecting, what you are not protecting. And of course, if we take out the 5 the 5 bed net protected bites, you can actually see where your gaps in proportion are. So if you focus in on the 5 bites that are happening to people under bed nets asleep, I'm sorry, I'm confusing myself. These 5 bites are happening to people who are asleep, not under bed nets. You can take this out of this whole system, right? But you probably cannot do anything about these 5. And you might not be able to do anything about these 2.5. So this enables you to understand what impact your intervention might have. And if you're focusing on SBC, or social behavior change communication, in this community, you will protect these people who are asleep, not under bed nets, but you can't protect the people awake and you can't protect the people outside, right? So expectations of impact are really important, especially when you're communicating it to your bosses. And if you say, I need $5,000 to do an SBC campaign, and that will reduce this number of bites and this much of exposure, and so consequently that amount of disease, that's really realistic and fair and will enable you to understand what to maximally impact. Now, of course, we can make it a lot more complicated. People indoors, with and without bed nets, same outdoors. And I'm not going to do this because I'm pretty sure you understand this concept right now and you can do this. And what's really cool is that you can do it each of these data sets, not just for 1 hour in the night, for every hour in the night. And you can do it for different ages and different males and females and different people with different jobs. If you collect this data, you can actually understand when and when children are being more exposed, when and when men are being more exposed, or women. Let's say your men over the age of 15 are being mostly infected with malaria. You can do this evaluation and see where and when they're being exposed and why women and children are being more protected, right? So getting your data to answer your specific question using both human behavior, vector behavior, and the interventions in place can help you understand so much more. Uh, Here's an example of data that we collected, and this is the bar graph is the human behavior. The black is people outdoors. You can see they're outdoors almost throughout the night. The gray is people indoors awake. The bed net like crosshatch is people asleep under bed nets, and the dotted is people asleep not under bed nets. And I've overlaid here the human behavior, which is the bar graph, as well as the line graph. The red is mosquito biting rate outdoors, and the blue is mosquito biting rate indoors for each of those hours. In the previous example, I said just 1 hour, but we can obviously collect this for every hour. So this is just the raw human behavior data and the raw mosquito data, correct? And now, if we do that analysis of combining the human data with the mosquito data, this is what we actually get. And just based on this example, we can see the red, which is outdoors, that most of your biting at this site is happening outdoors. And you can see the protection by bed nets, which is a crosshatch. And the dark blue right here and right here is the proportion of bites happening when people are indoors and awake. And the lighter blue is proportion of biting happening when people are indoors while asleep. Now, if you increase bed net use, you can just get rid of this light blue proportion. Now, what do we do about the biting outdoors or the biting when people are indoors awake? And we'll have to think about that, right? So just an example of how human behavior plus vector behavior can be used to really increase our understanding of what's happening at the site and how to respond to what's happening at our site. We can use it to evaluate how protective interventions are as well as how they are not protecting people, as well as how to improve or optimize the present intervention. So towards calculating the yes,
Neil, I'm
yes.
sorry.
No, no,
Could
go
I
ahead.
ask that at a convenient point, can we wrap it up for the lectures for the day? Because we're
Sure,
starting to test the staying power of people. We've been
sure.
going for an hour now, so I think
Okay.
we should wrap up when it's a suitable cutoff point.
Okay. I think I have maybe 3 or 4 minutes more, and then I can stop, if
All
that's
right.
okay.
Okay.
Thank you, everyone, for your patience. Okay, to calculate your HBO, human behavior adjusted exposure, there is this paper publication out there. And in the publication, they have these crazy equations, which I get so stressed out with these equations. So, and it's technically really simple to do, as I explained, but the equations can be really tough to understand because not all of us are great mathematicians like other authors on this paper. So what we have done is generated this human behavior calculation sheet where it has the ento data to input, the human behavior data to input, and that's all you have to enter. Everything else is done automatically for you. So if you would like access to this sheet, please email me or send your emails in to Leo, and I'm happy to share this sheet with you. Oh, Leo, I don't mind providing this as one of the things in the packages with all the presentations that people can have. Uh, of course, this is a very simplified analysis sheet, and you might want to include people indoors and outdoors with bed nets and things like that. So you might have to adjust this for your data. Of course, with this data, you want to combine epidemiological data. You don't want to use just entomological data alone. So you want to integrate your data sets with other kinds of data. And that would be for optimal decision making. You'd also want to, besides end-to-end epi data, you'd want to put in vector control data, rainfall data, human behavior, all these other kinds of data, just so that we are better off at understanding what's happening. In the ESPT, we have a couple of tables that tell us which vector behaviors are targeted by which interventions. Uh, and you can see the intervention on the vector behavior on the left and the intervention up on the top. For example, that's bed nets and which behaviors and endpoints we'd want to measure. The same thing is to evaluate an intervention. So this is to see if there's a potential of an intervention, and this is to evaluate that intervention. And of course, a summary of this entire slide set, I'm trying to be quick right now, is that it's important to have your indicators aligned to your program question. Minimal essential indicators are really important. It's important to capture how humans and vectors interact, and this will impact which interventions you choose, right? And this system will allow you to evaluate and optimize your intervention package. And I'm done. Thank you, Leo, yeah, for being patient with me.
No, my goodness me, it's us that need to thank you. And I think our audience members will agree. It's been an absolute masterclass with so much wonderful, excellent information presented in an easy to digest, very likable way. So thank you for that, Neil. Look at all the hearts and thunderclap, hand claps and everything coming up. Everybody agrees. May I tell the audience? There have been more than 900 of you participating in this lecture. So thank you for your resilience in staying through 2 hours of almost 2.5 hours of lectures. Thank you for completing the survey questionnaire. So we're going to have a Q&A session. Neil, if your throat can hold out for 10 minutes or more, just to deal with some of the questions. We're not going to be able to do all the questions. They're just too many, and I hope you understand, our precious audience, that we'll try our best to answer some of them. Neil has very kindly offered to respond to as many of the others in his own time, and we will send it out by email or post them. So the answers will get questioned, maybe not in this live Q&A session. So Neil, what I'm going to do, if I can
Sorry,
work out,
Vittorio, we
sure.
cannot send resources via email, but please find the resources on the link that I shared in the chat box. We are unable to send an email to individual. Please know that. Thank you.
Okay. All right. Thank you for that, Werlein. Neil, can you see my
Yes, I
screen?
can.
All right.
Yeah.
So I've randomly culled questions that I thought may be of relevance to more than just one person, but to more people. So you mentioned this in passing, how to identify susceptible and resistant mosquitoes. Maybe just briefly mention again WHO and CDC
Yeah.
assay, just very briefly, just to remind people how it's done.
Yeah. So mosquitoes normally should be susceptible to the insecticide you're using in your intervention, like bed nets, but they do develop resistance. And WHO has specific criteria and an assay with which to measure this. There are WHO bioassays, and if you Google WHO bioassays insecticide resistance, the entire protocol and everything is on there. In the same way, the CDC also has bottle assays, which are slightly different, in which to measure to see if mosquitoes are resistant or susceptible to the insecticide you are interested on. Basically, what happens is you take your mosquitoes, your local mosquitoes, and you have a susceptible strain of mosquitoes to compare them to, and you expose both of these types of mosquitoes to the insecticide, and you want at least 98% of them to die to have a susceptible strain, for them to be susceptible. But if more than 98% survive, they are possibly resistant or resistant based on the number that survive. These are available online. The protocols are available online, and you can email the CDC, or there's a specific WHO uh, site to email them that's in Malaysia to order the WHO susceptibility kits. I hope that
Thank
answers
you.
your question.
Yeah, no, that's great. Thank you for that, Neil. So here's another question. What is a short and sweet definition of vector surveillance? If somebody asks you, what does vector surveillance mean? And can it be adapted for other vector-borne diseases?
Yeah. Yeah.
Quick.
So vector surveillance, no one's ever asked me this. So vector surveillance is basically going out and looking at specific aspects, collecting specific data, critical data that's for decision making to ensure that your malaria vector control program remains effective and responsive to anything happening. And it's based on, as I mentioned, questions. For example, if your question is what mosquito species are present at my site, my vector surveillance would be going out and collecting, using a sampling method that collects as many vector species as possible to understand what the vector species composition is. I guess vector surveillance is going out and collecting data on vectors. That's the shortest,
All right. That's
roughest
great.
answer. Yeah,
And it can be adapted for
absolutely.
leishmaniasis and sandfly vectors, and uh,
Absolutely.
just
Yeah,
adapt it based on what you want to monitor.
exactly.
So, since there are country-specific non-entomological drivers, is the ESPT adapted to work in every country to arrive at desired surveillance outcomes?
Yeah. So the short answer is yes. The ESPT is a logical framework. It tells you how to think about it. And so it's up to you to adapt the thinking to your site. It is absolutely adaptable. You are correct.
Indoor resting, just reassurance here for the person. Indoor resting density is the proportion or account per house per collection time. Just needs a bit of reassurance there.
Yeah. So the indoor resting density is the number of mosquitoes resting per house per collection time, per night or per hour. You can look at it as a proportion of all mosquitoes you catch, which is in a way more useful. For example, if you do indoor HLCs and outdoor HLCs and you catch 100 mosquitoes total, and only in your indoor resting density collections you find 20 mosquitoes, that means the proportion of mosquitoes resting indoors is 20 divided by 100, right? But indoor resting density by itself is just the number of mosquitoes resting indoors per house per collection time.
Thanks, Neil. So many of these questions relate to issues that you've already explained, but presumably the questions were posted before you reached the point where you actually spoke about it. So, the person who posed the question probably got his or her answer as you continued with the lecture, but it's good as a refresher or reminder. Why is it important to know the composition of mosquito species at a research site?
Yeah. So different mosquito species have different behaviors and they transmit malaria differently and they're impacted by mosquito interventions differently. So knowing the species composition at your site and their behaviors and how they interact with humans and with the interventions will really tell you how well you can protect them as well as how well you cannot protect them or protect humans. I mean, how good of a job, well, where and when you can protect them. Sorry, I confused myself right there. Yeah.
Why is malaria transmission largely determined by the local vector species present in a particular area? How can species-specific mosquito behaviors influence malaria transmission?
Okay, so local mosquito species are the ones that infect the local people, right? So if they're the ones infecting local people, they're the ones who determine malaria transmission at the site. Of course, there are exceptions, for example, with migrant populations, when people with malaria from other sites come into your site, they can introduce a lot of malaria. But the ongoing transmission is by those local vector species at the site that bite those people, right?
Thank you, Neil. What challenges are commonly faced during field surveillance?
Absolutely everything you can think of that can go
You've only got
wrong.
1 hour to answer this question.
Yes,
All right.
everything you can think of that can go wrong will go wrong. Since you're out in the middle, a lot of the times in more remote areas, and you're dealing with humans, right? And you're dealing with functioning at night for malaria mosquitoes. So everything can go wrong. There are issues with electricity, with rainfall, with trying to find somewhere to stay, with local people not wanting you to be around there, with people not wanting you to be in their house to collect mosquitoes. Everything that can go wrong will go wrong. You need to be prepared for it. Yeah.
So here's an important, well, for me, this is a particularly interesting question, very relevant. How can entomological surveillance data be better integrated into epidemiological surveillance platforms to enable timely evidence-based decision making? In other words, how do you get program managers to actually make use and use your entomological surveillance data and integrate that with the epi findings?
Yeah. This is another 2 hour long conversation.
Yeah.
It is absolutely essential, and whoever asks this question realizes how important it is for people to talk to each other with their different data sets. So, and if you get the person who's making the decisions to understand how important the link is between ento data and epi data, and if you actually have the people doing the ento and epi data collections talking to each other, they can see how the rise in mosquitoes causes more malaria, or this intervention reduced malaria and reduced mosquito population. So it's just communication and trying to have a platform where the two data streams can function together. It's difficult, but it is possible, and some countries are actually doing it really well. It's again a 2 hour long question.
Yeah.
Honestly, I mean,
So Remy Bliss posed a good number of questions. Some of them are in the questions above, but here's another one from her. And you did deal with this, but let's remind ourselves again. What minimum core entomological indicators should national programs consistently monitor to support malaria elimination efforts?
yes, so this is a great question. And there are entomological indicators, and it's hard to say which ones because it's based on your specific question. Are you trying to understand the gaps in protection, or are you trying to understand how your intervention functions? If there was a core set, I would go with core indicators that understand what's happening with your mosquito population, what your mosquitoes are doing, and how your intervention is affected. So you understand how and where you're protecting people, how to optimize your intervention, as well as what the gaps in protection are, where your continued malaria transmission is coming from. So if you have a question, I'm happy to re-answer this based on that. But it would be based on mosquito species composition and species-specific behaviors and insecticide resistance. Yeah.
So, Neil, here's a question that for me, I rephrased it, at least according to my interpretation in brackets. So let me read the original question. For areas that have never had any malaria cases, is vector surveillance still necessary? And what should be done if malaria vectors, whether larvae or Anopheles mosquitoes, are found there? So I kind of framed it this way. Why should one continue vector surveillance in countries or areas where malaria elimination has been achieved? Uh,
This is a great three questions. So why should one continue vector surveillance in countries or areas where malaria elimination has achieved? And this we should continue, or we can continue based on available budgets, even though we don't have enough money, because this will tell us when that population is susceptible to reintroduction of malaria. For example, in Sri Lanka, they continue malaria surveillance for the vectors to ensure they know what's happening with the vectors over time. But it's not at a level that we do when there's higher transmission or transmission at all. So you can sort of keep your finger on that pulse to understand how susceptible that site is to malaria. But again, you can use epidemiological data or one single case to sort of precipitate yourself do an actual or increase your vector surveillance.
So here I did the same thing, Neil, kind of rephrased the question based on my understanding. What is the average time between conduct entomological survey and implementing the finding, considering the dynamism of mosquito bionomics? I've kind of shortened it here. How frequently should one conduct surveillance?
So I actually have a short session in this later on tomorrow, day after.
Uh,
I don't remember exactly, but it's basically based on your budget and seasonality. The more often, the better resolution you have, the better data you have. But if you want to do minimal, I would just do it seasonally, right? To try and understand what's happening at each season. I would factor in your budget and capacity to see what's the maximum you can do based on your question.
all right. I think we've done extremely well. Our audience numbers are starting to dip, I think. Um, Oopsie, I don't know how to stop sharing. Stop share. So yeah, we're still standing at 820, which is a very, very strong number, but it's 100 less than what it was an hour ago. So, people are starting to drop off. And I understand that. So, I think we've done extremely well. Neil, again, from all of us, thank you sincerely for top, top, top quality presentation, sharing with us that mountain of knowledge that is in your bald head. So, wonderful, wonderful presentation. We're very grateful. Thank you to our audience for staying, hanging in there. Well over 2.5 hours now already. And Wulan, thank you for your help in the background. I'm not sure if Dr. Porn is still there, but to him as well. To everyone, we look forward to seeing you again tomorrow, same time, 1 p.m. Bangkok time. I'm sure you're going to enjoy it as much as you did today, I have no doubt. So thank you, Neil. Thank you, Wulan. Thank you, audience. Great day today. Keep well. See you tomorrow.